Welcome to the Voices of Hospice Leadership podcast, the show that reveals how to take your hospice to the next level. We cover all things hospice, from marketing and automation to billing and operations. You'll also hear from professionals in the industry as they share their stories of success and practice growth tactics. Here is your host, Brian Frantz.
All right, welcome to the Voices of Hospice Leadership podcast, where we speak with hospice leaders and industry experts about what it takes to serve families well and lead with purpose. So today I'm joined by Shahrouz, owner of Healing Care Hospice. We're going to be talking about what hospice really is, why hospice is not the same as giving up, and what families should know before choosing a provider. So Shahrouz, thank you for joining us today.
Thank you, Brian. It's a pleasure to be here.
Great. And why don't you start by introducing yourself and tell us a little bit about Healing Care Hospice?
Sure. My name is Shahrouz Golshani. I'm the founder and president of Healing Care Hospice. I started the company in 2012. Took about 3 years to get licensed and accredited and Medicare certified. So we were starting to take care of patients towards the end of 2014. So we've been a very active hospice for about the last 12 years in Southern California.
Awesome. I always think it's helpful for families and referral partners to understand a little bit about the person behind the organization. I think because hospice is such a personal service.
Of course.
Your background was not originally in hospice. What led you to this work, and what made hospice feel meaningful for you?
Well, I actually started out working for a few different software companies, and then I switched to commercial real estate. I worked with my mom and dad. We had a small family office, commercial real estate family office. And, it was okay. I enjoyed working with my family, spending time with my dad, my mom and dad. But there was something that was missing, and I had done quite a lot of volunteerism and advocacy around the issue of homelessness. Probably for 15 years, I'd done this before I started Healing Care Hospice. And, I sat on a couple of nonprofit boards. I even started a program called 1,000 Homes that was about educating people on permanent supportive housing and spreading the word and influencing decision makers, et cetera. And that was very fulfilling for me. So in 2008, when the commercial real estate market crashed, I decided to go to graduate school. I went to business school at UCLA Anderson, and I was there work nights and weekends. Program was took 3 years. And in 2011, I finished, and I was kind of looking for something new to do, and looked at different opportunities in healthcare in particular. At that time, healthcare was really dynamic and changing and growing with the passage of the Affordable Care Act, and really many other industries were going sideways, if not contracting, because of the economic downturn. So I was looking at different healthcare businesses, and I thought that hospice might be a way to kind of start a business and grow it, and create jobs and create opportunities, but also, to make an impact, to do something positive, to basically, address needs out there that aren't being met, much like I had done when I worked with organizations helping the homeless. I thought that this might be a way of doing something, positive for the community.
Yeah. Awesome. Yeah, I think that mission piece is so important because hospice can be sometimes misunderstood till a family actually needs it. Um, when a family asks you what is hospice, how do you usually explain it?
Okay, that's a great question. I feel like oftentimes hospice is misunderstood, even by some people in the healthcare community. So I think it's important to cover it. So hospice is care that is provided at the end of life to bring comfort and support to patients and their families, right? And I usually describe hospice in two ways. Well, I'll cover the hospice approach to care, or the hospice philosophy of care, and then I'll talk about the details of the Medicare hospice benefit, right? So the hospice philosophy of care consists of 4 parts. First part is the focus is on comfort and support rather than seeking a cure. The practical application of this is that when someone comes on hospice, they forego curative care. That means that they are no longer going to go see their primary care physician unless that primary care physician is going to follow them on hospice, and they're not going to be able to go to see their specialists, right? So if they have cancer, that means they're no longer going to their oncologist, or if they have heart disease, they're no longer going to see their cardiologist, et cetera. This is probably the most important thing for families to consider, is that it is a very stark choice. You are giving up something and you are gaining something new. And I think that's an important thing to think about. Basically, hospice becomes appropriate when the costs and burdens of curative care start to outweigh the potential benefits of curative care. Right.
Okay.
So the second aspect of the hospice philosophy of care is that we care for the patient and the family as a unit. So while we're doing symptom management and providing emotional support and spiritual support for the patient, we're also providing emotional and spiritual support for the family. Thirdly, it's very important to us to be able to deliver a personalized plan of care for the patient and the family. So it's very important that we get to know the family, their particular dynamics, their culture, values, beliefs, traditions, their goals, very importantly, and that we create a plan of care that is customized for them. And we very much encourage them to be involved in determining that plan of care and, any changes that may need to be done on an ongoing basis. And then lastly, in hospice care, we seek neither to lengthen life nor to hasten death. So we are doing symptom management, bringing comfort and support, and providing emotional and spiritual support. But essentially, we're allowing nature to take its course. So we're not taking extraordinary measures to lengthen life. And even though sometimes families may ask, we do not take any measures to shorten life as part of hospice.
Yeah.
So that's the hospice philosophy of care. Now, what is the Medicare hospice benefit? And I say Medicare because most of our patients are Medicare patients. And then anyone else that comes on hospice, whether it's covered by Medi-Cal or commercial insurance, typically the Medicare model for hospice is what governs. So that's why it's important to kind of go over the details of that. Care is delivered through an interdisciplinary team. At the head of the team is our physician. The physician and the nurse are working hand in hand to address any symptoms or distress that the patient may be feeling. So pain, nausea, vomiting, shortness of breath, constipation, et cetera. They're working very diligently to minimize those symptoms. Typically, the RN case manager is going to be visiting the family 1 to 3 times per week. Then there's an aide that's there to do personal care, so bathing, dressing, toileting, ambulation, range of motion exercises if appropriate, or and the aide is typically visiting 3 times a week. Sometimes we can do up to 5 times a week aide visits if the family really needs it. There's a social worker that's there to provide emotional and spiritual support, but also to help with any type of legal or financial like paperwork, or to make referrals for benefits or services that may be available in the community. Typically, the social worker is visiting the family 1 to 3 times per month. But if they're working on a project for a family, they're going to be there more often. They're going to be spending more time with the family. And there's a spiritual counselor that is there to provide emotional and spiritual support in a way that is appropriate for that family. So they're very knowledgeable in different cultures, different religions, and the idea is that they're there to meet the family where they're at. So the family is, let's say, for example, Catholic and very religious. They can speak that language and know those traditions. But if the family is not religious at all and is not really interested in that, the spiritual counselor can speak to them in a more kind of human to human basis. And so that's the team. Typically what the family will experience is someone from our agency coming maybe 4 to 5 times per week. They come for about 45 minutes to an hour, and then they leave. And the reason I explain it like that is because while we're visiting, what would seem like quite often 4 to 5 times per week, maybe about 20 to 22 times per month, we're there for about an hour and then we're leaving. So we're not in the home all that much in reality. So I like to think of it as a partnership between our agency and the family, where we're doing the medical management and providing emotional and spiritual support, and the family is doing the day to day, hour by hour personal care. Now, we're always available 24/7, so they can call us, talk to a nurse within a couple of minutes, day or night, even in the middle of the night. And if we need to, we can send a nurse. That'll usually take about an hour. But we can send a nurse if the nurse needs to, she can stay. If the patient is experiencing out of control symptoms that cannot be addressed with that 1 hour visit, we do have the ability to do a different level of care called continuous care, where a nurse will come and stay for an 8-hour shift, and then we'll replace that nurse with another 8-hour shift. And we can do this until the patient is stabilized. We also have the ability in an emergency type of situation with out of control symptoms to take the patient to a nursing home for what's called general inpatient care. And, maybe for a few days until they stabilize and then bring them back. And then there's another option called respite care, where if a family needs rest, or maybe the caregiver needs to go out of town or needs to take care of some of his or her own medical needs, the family can take the patient to a nursing home for up to 5 days and then bring them back so they can get that respite, essentially. So those are the levels of care. And just lastly, medications that are related to the hospice diagnosis we cover, and they're delivered to the home. Medical equipment, any medical equipment that the patient may need, we have delivered to the home. And then we also help with medical supplies like diapers and chucks and gloves and wipes and things like that. We send a certain amount to the family each month. And that's hospice care.
Yeah, awesome. Hospice 101.
Yeah.
Yeah, I think that was there's a number of really important distinctions in there. And I think many families hear the word hospice and immediately think like, no more care or end of care, right? When it really is just a different type of care.
That's
What do you
right.
think?
It's palliative care versus curative care.
Right. Yeah, I love it.
But there, you know, I can't speak for the entire hospice community. I can just speak for my company. But families oftentimes have this fear, and that we're just basically going to give the patient morphine and wait for them to pass away. But that's not the case. Like, we actually do a lot of things clinically that set us apart from other hospices. So we can do labs, to see if there's an infection, and then prescribe medications. Patients coming from the hospital that are on artificial nutrition, for example, the family sometimes requests that they continue artificial nutrition. We can do that for a limited amount of time with a product called Clinomix. IV hydration or IV antibiotics we can do for a short amount of time. If a patient has fluid buildup in the abdomen, ascites, or they have fluid buildup in their lungs, we can have a paracentesis or a thoracentesis done, 1 or 2 a month. If the patient is on a pain pump and they need a pain pump, we can accommodate that. Or if they have challenging wounds, we can accommodate that. High flow oxygen is also something that we do up to 60 liters. CPAP, BiPAP. So there's a lot of things that we do clinically in the pursuit of comfort, but also in helping families make that transition from the hospital home. We like to say yes. We don't want to say no when families ask things of us. Of course, the care that we provide has to be clinically indicated, and some of the things that I just described are kind of transitional, it's kind of short term, but it is oftentimes very helpful to help families make that transition to a hospice care.
Yeah. What you mentioned one of the misconceptions there, but what are some of the biggest misconceptions families have about hospice?
Sure. So, I think the biggest fear is probably that, hospice care, if we put our loved one on hospice care, we're abandoning them, or we are, stopping all care, and that the patient is going to die very quickly. Sometimes we have patients and we admit them and they live a few days. Sometimes we have patients and, we admit them and they live a year, and, they kind of stabilize, and then, we have to discharge them for extended prognosis because they're not declining and they no longer meet the criteria for hospice care. Right. So, hospice care is not, does not mean that your loved one is going to pass away very quickly. It just depends on how they're doing. Actually, studies have shown that people tend to live longer when they're on hospice care compared to curative care if they're at end stage, because their needs are being met and their symptoms are being managed, and out of control pain or shortness of breath is no longer taxing the body because it's being addressed.
Right. Yeah, I love it, and I think you kind of hit it there. One of them that I was thinking, right? It doesn't mean you're giving up, right? It's not about giving up. Maybe
it's a reframing, right? Yeah. So, unfortunately, when your loved one gets to the point that the curative care that they have available to them is no longer working, right? Unfortunately, families have to come to terms with the fact that their loved one is declining and will pass away. I went through the same thing a few years ago with my father. Mm-hmm. It was hard for our family. My mom had a very hard time with it. But part of coming onto hospice and the hospice team doing what they do is helping families kind of come to acceptance that, curative care is not working. But so it's a shift from wanting a cure to perhaps, making a commitment that you're going to make the most of the time that you have left.
Yeah.
So it's a reframing, right? From seeking a cure to really focusing on quality of life, focusing on addressing, life closure issues, mending, relationships, telling your loved ones how much you love them, saying sorry if you need to, or allowing them to say, sorry. Basically, kind of, if possible, to wrapping life up in a positive, healthy way. So it's not giving up, and it's just a different undertaking. Rather than trying to cure illness, you're working on a positive life closure.
Yeah. I think that that can really help families, feel maybe less afraid to, ask questions earlier. What do you think?
Difficult. Like
Yeah.
it's very difficult. It's difficult for families. It was difficult for my family. If it is easier if the physicians that are the specialists that are taking care of your loved one are good communicators and give the family the time that they need to understand really what is happening with their loved one, and what their prognosis is, and if there are any treatment options, what the likelihood of success of those treatment options are. So if families have all of this information and it's explained to them, and they can make a decision with open eyes, it's easier. Oftentimes, families are in this state of kind of haze and confusion, and there's different family members involved in the decision making, and they don't have the full information, or they don't understand really what's going on with their loved one, and there's also denial and pain and trauma kind of mixed into there, so it just becomes very difficult.
Might be getting mixed messages, and some might be closer to the family, that a member of the family, or maybe a little farther away, and still wanting to hang on. When do you think?
And they might be getting mixed. They might be getting mixed messages even from the medical community.
Exactly.
Where maybe the hospitalist at the hospital is telling them one thing, and then their specialist is telling them another thing, and their PCP is maybe saying another thing, and a patient is declining and has needs, would really benefit from hospice, but they don't want to make the wrong decision, understandably. And they will sometimes, families will sometimes, pursue curative care, for a while, and until it's it's obvious that really it's not working, and that hospice care would be a better option. But sometimes at that point, there's not a lot of time left.
Right.
Unfortunately.
Yeah. When do you think a family should start asking questions about hospice, even if they're, not sure they're ready?
Yeah, I mean, I feel like for families, the best time to talk about hospice, and even the best time to talk about decision making, like advanced care planning, right? The idea of talking about, like, what if you end up in a situation where you can't make decisions for yourself, who do you want to step in and make those decisions for you? Assigning an agent. Or if you're in a position where you need, artificial respiration, is that something that you want? Et cetera. Right? The best time to make these decisions and to think about these issues is when they're not really imminent, so the sooner the better. Like I say that families should engage in advanced care planning with maybe an attorney or maybe with someone in their, doctor's office or with their medical group as soon as possible. If you have an elderly parent, you should encourage them to undertake this type of work and to have a plan. A lot of times seniors, for example, are living by themselves, or maybe there's a senior couple and, one of them passes away and then the remaining family member is still living by themselves, sometimes for many years. And that's what they want. And that's wonderful. Right. But families should still be thinking about what happens if mom can no longer safely live by herself. They should have some type of plan. Think through these issues rather than have to deal with it when, she has a fall, for example, and ends up in the emergency room and is admitted. And then the case managers at the hospital don't feel comfortable discharging her back to her home because there isn't a full-time caregiver. And the family can't afford a full-time caregiver. They haven't thought about it. They haven't planned for it. And, they don't know whether she can live with one of the siblings, et cetera. So when you say, when is the best time to think about hospice? Where my mind goes is even before hospice, like advanced care planning is a very important thing. And life planning is a very important thing, and families that do it tend to have an easier time, and that families that put it off end up kind of in this, crisis situation with the, having difficult conversations with the case manager at the hospital about, where's mom going to go? But I think that for medical professionals, it's good to talk about hospice care and introduce hospice care if they feel like a patient has a prognosis of 1 year or less, to just bring it up. They're not appropriate for hospice at that point. They should not go on hospice at that point, but it doesn't hurt for them to know about it, what it is, what it includes, what the choice involves. I think it's best to educate people and for people to learn about things when they don't need to make that decision right at that moment, so they can kind of like live with it a little bit and it can kind of sink in, and, they can talk about it with different family members or maybe an attorney or maybe their primary care physician, and, kind of process these issues in a slow and deliberate way.
Okay. Give them time to digest it, right? And I think
Exactly.
let's not wait until there's a crisis and
Exactly.
and now you're overwhelmed. And, I love that. Let me ask you this: do families need a doctor's order before calling hospice? To learn more or ask questions?
No, families can call us, anytime and talk to us, and we're happy to come and visit with them and, talk about hospice care, or talk about it with them over the phone and answer their questions. Once, if we feel like their loved one is appropriate for hospice, or, and they want to start hospice care, then at that point we do need an order. So we would reach out to their primary care physician or a specialist that they're working with and ask for an order and explain the situation. If there's a situation where there's no doctors, the patient hasn't seen a doctor for years, there's no one, taking care of that patient, et cetera, We do have the ability of sending our own doctor for a hospice evaluation, and they can write an order, but we would prefer not to do that.
Yeah. Gotcha. I think that's important for families to understand, right? I think it's not that first step doesn't mean commitment, right? It's just information, just getting
Yeah,
some
exactly. Look, the way I look at it is hospice is not for everyone, right? Hospice is a very nice service for families that need it
Mhm.
and families that want it.
Yeah.
Right. And I think that it's very important that families understand what it is that, what it is and what they're getting and what they're giving up, importantly, so that they can go into it with open eyes and really, benefit from what we have to offer, which is, again, our hope for our patients and our families is that they have a peaceful, hopefully positive life closure.
Yeah.
Right. And that we've made a positive impact on that family and that patient and possibly on that family, for years to come, because of that experience. So, if a family doesn't want it, it's, they shouldn't go on it, because all that's going to happen is as soon as that there's some type of change of condition, they're going to call 911 and they're going to be in the emergency room. But,
Right.
the decision to come on to hospice also does not have a very rigid finality to it, right? So a family can decide, they want to come on hospice, and then a week later, a month later, they could change their mind and they can go back to curative care if they decided that, this is not really for us.
Yeah, I think that's important. Yeah, I love that. And it's not a contract, right? They can revoke that privilege. They could graduate, right? They could come in, the team can come in, they can get cared for, and now that patient doesn't meet the criteria anymore, they're stable. And
if the patient is not actively declining, and they haven't had infections or falls, and there's no reason for them to be on hospice, then they should not be on hospice. And Medicare has very strict guidelines about that.
Once the family is ready to learn more, what's the next challenge, I guess, maybe is knowing like who to choose, or like what provider to choose, right? What hospice provider.
Sure.
What should families look for in choosing a hospice provider?
Well, Medicare has actually done a lot of work to help families choose providers. So there's a website called Medicare Care Compare, and they can go on there and they can search for hospices in their area, and they can see, what hospices have high star ratings, right? And the star ratings are, they come from different data that Medicare collects, whether it's patient care data or it's, client satisfaction data that are, the families that we've been taking care of, they get surveyed by a third party, and then they turn these surveys in and they get uploaded to Medicare's, databases. So they can check a hospice's star ratings. I think that's a good place. Many people, will ask for, referrals from their primary care physician, et cetera. And I think that's fine. Although, sometimes doctors are employed by hospices, and, they feel obligated to refer all their patients, to that hospice that they're employed with. And sometimes those hospices are not the best. So that's why I think it's still, good for families to research and check the star ratings, and also go on Yelp and check reviews and do your research, call and ask a bunch of questions and see how the interaction is going, how it feels.
Yeah, I think that's great advice.
Yeah.
many people might not realize, right? They actually have a choice in this and who provides their care.
Yeah. Yeah. If a patient has Medicare, they have total choice. If a patient has Medi-Cal and they're part of a managed Medi-Cal plan, there may be like a more limited network of contracted hospices, but they still have a choice among those.
Right.
And same with commercial insurance, so nobody should feel like, they're obligated to work with a particular hospice company because that's who they were referred to. In fact, I would be very, wary of that and recommend to people to check, star ratings on the Medicare website and also to read reviews on Yelp and Google.
Love it. You mentioned, that, asking a bunch of questions. They should, what are some questions that they should be asking or looking for?
Okay. That's a great question. So, I think one really important determinant of quality care is, who's doing your case management? Is it RNs or is it LVNs? Like for us, we only use RNs for case management and we use LVNs for unscheduled visits, right? That's an important factor. Also, how long is it going to take you to get to me if I call you in the middle of the night? What's your response time? Let's see, what other questions? How often are people going to come and visit? What I described earlier, where, our staff is making 4 or 5, sometimes 6 visits a week, 20 to 22 visits a month. That's for Healing Care Hospice. Some hospices, they do less. They do the bare minimum. Maybe they don't have the staffing or, the costs for something like that are too high. So really just dig into all the details.
Love it. Yeah, I think, once family chooses a hospice, it's important for them to know they still have, options and rights.
Right.
So I think you mentioned it a little bit, just a minute ago, but a patient can revoke or, their privilege or choose another provider if needed, right?
Yeah. If you're on hospice care and you're not happy for whatever reason, you can stop hospice care. That's called revoking hospice care. If you're not happy for your provider, you think it's not a good provider, you can transfer once. This is for Medicare. You can transfer once per benefit period to a different provider. And so, you're not revoking, you're just transferring. But yeah, Medicare wants you to be happy, wants you to receive good care. They're certainly spending a lot of money on hospice care, and they expect, as should all, families, that the care is good.
Yeah. Maybe we could talk a little bit about healing care specifically. I think, the provider a family chooses can really shape their experience. So what do you believe makes Healing Care Hospice different from other providers?
Sure. So many things. Like one thing I can say is, families are typically dealing with their RN, right? As I mentioned, the RN is working with the doctor to do symptom management, but the doctor is not coming to the home typically. But at Healing Care, if the family wants to talk to the doctor or if they want the doctor to come and visit, we can accommodate that, right? And that can be very helpful for families that are, worried that, maybe hospice is not the right option. Maybe they came out to hospice too soon. and having the doctor come and assess the patient again and to talk them through their options can be very, very helpful. Also, a lot of the clinical care that I described earlier is unique to Healing Care. There may be some other large hospices that can do some of the stuff like IV hydration, IV antibiotics, artificial nutrition, paracentesis, thoracentesis, pain pumps, etc. But I feel like we go above and beyond, to accommodate patient and family's clinical requests when appropriate. Also, Healing Care has a long tradition of focusing on the Latino community, and a majority of our staff are Spanish speaking, right? And if a family wants an all Spanish speaking team, we can accommodate that. So from the clinical liaison that comes and meets with the family and explains hospice care and describes hospice care, and they sign up for hospice care, to their RN case manager, their social worker, their chaplain, their aide, can be all Spanish speaking.
Yeah. Awesome.
Yeah. Also, we also, for patients that are with Optum, we do palliative care. So it's we participate in a palliative care program with Optum Health, and so that's kind of like a pre-hospice option. We have a lot of patients that we work with Optum, so that's also a unique thing that we're sending a nurse practitioner or a doctor once or twice a month to basically make sure that patients are okay, their needs are being met, they're staying compliant with their care plans. But it's not hospice. They can still go and get care from any specialist that they're working with.
Right. Awesome. Yeah, I think hospice care requires a lot of compassion, and I think it also requires systems and communication and accountability.
Absolutely.
How do you balance compassion and or with like high standards and accountability?
Yeah, that's a great question, Brian. I'm glad that you brought that up. So we take great care in who we hire, right? It's very important for us to hire people that fit into our culture, and our culture is patient care first, right? That stands above all things, kind of a family atmosphere, family environment, teamwork, and also continuous, learning and development, right? So it's very important that we hire the right people that have the requisite skills, but also the right mindset and attitude, a service-oriented attitude, a caring attitude, compassionate. They have the right skills. And then we do a great deal of training. There's classroom training, there's one-on-one mentorship. We have a skills lab, et cetera. So we have a whole host of courses that we've created, web-based courses that our staff go through. So it's a combination of hiring and training, and then a culture that has very high standards. If we have nurses that aren't doing a good job, that aren't turning in their notes on time, or we're getting complaints from families that they're not very compassionate, they don't last. Yeah. They don't last. It just we cannot fulfill our mission of making a positive and lasting impact on patients and families, if we don't have the right people, showing up to people's houses. And,
right.
and they have to be very well trained, and also I think very importantly, we try very hard not to put our staff in, compromising situations, ethically, compromising situations. So we don't, we expect the highest ethical standards from them, and we expect them to, be good nurses and aides and social workers and chaplains, et cetera. And, in return, we provide them a platform where they can do the work that they were trained to do, that they were meant to do, and if,
Right.
we can find people that, for whom this work is a calling, all the better, because, those are the people that really do well with families and do well at our company.
Yeah, I love that. And I've heard that. And so like talking to so many different people in hospice, right? They all have that heart. They all have that calling for this work. And I think the quality of the team, right, really affects the quality of the care and the family's experience.
Absolutely.
Yeah.
I always will describe it in this way. When I'm talking to new hires, I say, we're trying to accomplish big things, big spiritual things with families. If we do our work right, maybe families can mend, broken relationships, before, because end of life is a difficult thing. It's a sad thing. It's also a big opportunity,
Yeah.
because at the end of life, people are open, there are times when we're reaching out to family members, that haven't spoken to their loved one in decades, and say, well, your brother's on hospice. Do you want to come and reconcile with him? Because he's not going to be around for too long. And they come,
Yeah.
and we, so end of life can be opportunity. And if we do our job right, we can accomplish great things, important things, I believe, for that family.
Yeah.
Now, that takes trust. You have to earn family's trust. That takes, you have to earn their respect. There's nothing that will destroy that trust and that respect more than a poor customer service.
Yeah.
Right. So if a family calls you and says, this wheelchair that you delivered, it doesn't work right, can you replace it? Right. Simple thing to do. One call to our DME company and they can swap it out. Right. But if you mess that up, then the family is going to put their guard up. They're not going to trust you. They're not going to respect you. Or maybe like they call you and say, family calls and says, we need a medication refill, right? Perfectly reasonable request and necessary. And if you take too long to do that, then they're going to put their guard up. They're not going to trust you. They're not going to respect you. So in order for the family to trust and respect us and allow us into their lives and allow us the possibility of helping them, have a positive experience in hospice, positive life closure, maybe, address some, issues within the family, et cetera, at this time, we have to get the customer service aspect right. Because otherwise you cannot have that. You're not going to have that trust and respect.
Yeah, I know. Hospice heard, from many different people I've talked to, but it can be emotionally heavy. And how do you support your staff and help them prevent burnout?
That's a great question. So because, in hospice, it's very different from, let's say, like the emergency room or the hospital, the med surg floor at the hospital, where, those patients are short term and the staff is, they care very much, but they're not, the patient is not there so long to, for them to really bond. But in hospice care, we encourage that bonding, we encourage that connection, and it can be very difficult on staff when they lose patients that they spent a long time caring for, and they built relationships with families. So, we have a generous PTO policy, and we encourage them to take time off and kind of replenish. We have done things in the past where, we've done support groups, for the team. We've done events around, grief and loss. Because like you said, the burnout can be very real, and it's important for us to keep the staff healthy.
Yeah, and supporting your staff, right? That's going to translate into better care for the patients and families.
Exactly.
Yeah. As we start to wrap up, I wanted to bring this back to the families who may be listening, wondering what the next step should be. So, what is one thing you wish every family knew or understood about hospice earlier?
That it's okay to call and, talk to us. If they feel like their loved one is declining and they may need hospice in the future, but not right now, it's okay to reach out to us and talk to us. We're happy to speak over the phone. We can schedule meetings at the home, and we can have just a kind of a educational session, and just so that, again, families are informed. They can go into these decisions with their eyes open, and when they do eventually start hospice, they can get something out of it. They can get something really positive out of it. So I would say, reach out to us. We're happy to speak to you. It's not, again, I don't believe in trying to sell families on hospice. I think hospice is a nice service. It's what we do. But I don't think it's for everyone. I think it's for families that need it, and it's for families that want it. And when you have those two things, then families can really benefit from it. But again, maybe my approach is a little bit different than others. But I'm very big on information, sharing information, education.
Yeah.
And a lot of times, even, when families reach out to us, we give them information about hospice, but we also give them a lot of information about how, housing, nursing homes and assisted livings and boarding cares, and, what, their situation. So we can be very helpful, prior to hospice also with some of that work.
Yeah, that's awesome. All that was shared. Those are all important takeaways, especially for families who, may be waiting because they're scared. Maybe some are just, unsure, not ready, but they don't want to make the wrong decision.
Absolutely.
What advice would you give to a family that's wondering whether it's too soon to call hospice?
It's very important that families understand what is happening with their loved one and what their options are. And if they're not getting that information from their specialists, then they need to ask for it. I'll give you an example. Patients that are dealing with cancer, right? It's a very difficult thing. There's a lot of treatment options now for cancer. And, doctors, oncologists, are very eager to put patients on these treatment options because, they want to extend their lives. They want to cure them if possible. There have been, tremendous breakthroughs, and all of that is wonderful, right? But if you're sitting with your specialist and they're saying, okay, this treatment option didn't work, but we have another one for you that we want to try. I think it's important to ask, like, what are going to be the side effects? What's the likelihood of success? And how long do you think I have left? And if the answer to that question is the side effects are going to be severe, the likelihood of success is very, very low, and maybe you have, 2 to 4 weeks left to live, then, families may consider a different option, but they might not be getting that information if they don't ask for it.
Yeah. How can families and caregivers, referral partners, how can they learn more about Healing Care Hospice?
They can go to our website.
Yep.
We have a website, healingcarehospice.com. There's a lot of information on there. They can call us and talk to one of our team members if they have questions. We're happy to talk to them. I like to, point people to Medicare Care Compare, and they can, look at our metrics, objective metrics, and also on they can read our reviews on Yelp and see what, families have been saying about us, that, that we've taken care of their loved ones, how they speak about us. So, any of those avenues would be okay.
Awesome. And promise we'll share that in the show notes, and so make it easy for them. Shahrouz, thank you for joining us today. And
thank you, Brian. I appreciate it. I enjoyed the conversation.
Yeah, awesome. I think one of the biggest takeaways from this conversation is, hospice is not giving up. It's not about giving up. It's about comfort, right? Dignity, support, and helping families. So thank you again.
Yeah, but I'll just end by saying, my hope for families is that they have all of the information that they need to make the decisions that they need to make. Right. So if the medical community is providing that, then great. If it's not, then they have to get it so that they can make decisions that they're comfortable with. And these are the situations where I feel like we can provide the most benefit, where, families are, again, their loved one is appropriate for hospice, and the family wants hospice because they understand that the curative path is no longer a great option for them, and now they're looking at a more palliative approach. Mm-hmm. So, my last takeaway is just I encourage families to get the information that they need from their physician, from their specialist, from the health system that they're working with, so that they can make the best decisions. And that we're happy. We're here to help. We're happy to help.
Love it. Thank you again, Shahrouz, and the team at Healing Care Hospice. And thank you for listening to the Voice of Hospice.
If you're looking to attract more families and share your hospice mission with a wider community, visit hospicecaremarketing.com/schedule to schedule your free consultation with marketing expert and founder Brian Frantz. Plus, join our free Hospice Marketing Mastermind group on LinkedIn to connect with other practice leaders and stay up to date with the latest strategies. If you enjoyed this episode, please take a moment to leave us a 5-star review. We'd love to hear from you.